Vivlodex is a prescription medicine used to treat the symptoms of osteoarthritis, rheumatoid arthritis, and moderate to severe pain. Vivlodex may be used alone or with other medications. Vivlodex belongs to a class of drugs called NSAIDs. How to use? Use the lowest effective dosage for the shortest duration, consistent with individual patient treatment goals. For management of osteoarthritis pain, the recommended starting dosage is 5 mg orally once daily. Dose may be increased to 10 mg in patients who require additional analgesia. The maximum recommended daily oral dose of Vivlodex is 10 mg. In patients on hemodialysis, the maximum daily dosage is 5 mg. Non-interchangeability with other formulations of Meloxicam. Vivlodex capsules have not shown equivalent systemic exposure to other formulations of oral Meloxicam. Therefore, Vivlodex capsules are not interchangeability with other formulations of oral Meloxicam, even if the total milligram strength is the same. Do not substitute similar dose strength of other Meloxicam products. Contraindications. Vivlodex is contraindicated in the following patients: known hypersensitivity, e.g. anaphylactic reactions and serious skin reactions to Meloxicam or any components of the drug product. History of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs. Severe, sometimes fatal, anaphylactic reactions to NSAIDs have been reported in such patients in the setting of coronary artery bypass graft surgery. Warnings. Not interchangeable with other forms of oral Meloxicam. Increased risk of serious cardiovascular events. Avoid concomitant aspirin at analgesic doses, other NSAIDs or salicylates. Caution with methotrexate, monitor for toxicity. Increased nephrotoxicity with cyclosporin, monitor. Concomitant pemetrexed may increase pemetrex-associated myelosuppression, renal, and GI toxicity. Adverse reactions: diarrhea, nausea, abdominal discomfort, anemia, cardiovascular events, GI bleed, ulcer, edema, hypokalemia, anaphylactic reactions, rash, hepatotoxicity, renal papillary necrosis.